Well, viewers, today we will be dealing with the item analysis using ZipGrade and Excel sheet. We have already some detailed workshop on item analysis, but different software are used for item analysis, especially for online machine reading devices. They are provided with different softwares and they give you a complete item analysis report. But certain colleges or institute have no access to free online software. Only they have access to some limited access to ZipGrade. So today this presentation is specifically made for those who use ZipGrade and how they will then prepare a consolidated item analysis report for further necessary action for the assessment unit or the quality unit of any college of medicine, dentistry, pharmacy, or any health profession. So let me proceed, and I will tell you that item analysis is usually done for multiple choice question and single best answer multiple choice question. But I'm going to start with one of the quotes. Some of the quotes are Professor Harden, and that is assessment drives learning, assessment is for learning, and assessment should be fair. Keep in mind, assessment should be fair, and this item analysis will provide you an opportunity that let your assessment is fair, so that it shall give a fair chance for what has been taught to the student, and that is properly assessed as well. But remember, some colleges are doing big blunder and mistakes that they all decide it through the multiple choice questions, and that is why Professor Harden says one of the principles of the assessment that is not a single method of assessment. I mean multiple choice question or short essay question or short answer question or MCQs or leading question. So a single method of assessment will not do it all for you. Therefore, your exam shall be a blend of multiple choice question, blend of methods of multiple choice questions, and at the same time there will be short answer question. There will be objectively structured practical or clinical examination, OSPI, and so many other different modalities of assessment, so that it shall give a fair chance of assessment. Let me tell you, I am Professor Niaz from Khyber Medical University, Peshawar, Pakistan, and presently being posted at College of Medicine, Shaqra University, Saudi Arabia. So this presentation is purely for education purposes. So let me proceed, and so that you shall have an opportunity to go ahead for the ZipGrade. These are the steps for assessment units, how to deal with an MCQ. And first you will have to perform item analysis, then prepare item analysis report, and you have to tag the question. Tagging the question mean that whether the question is easy, is it easy or difficult, and all these things will come in the consolidated report that we are going to do a practical exercise in front of you. Now, once you tag the report, the multiple choice question items are tagged, then how you are going to deal with these questions, especially which are difficult or having differently tagged as having with a negative discrimination. So let me proceed. Things will be clear. One of your tasks was at that time to go open your online machine reading report. This was for my colleagues at College of Medicines, but in one of the college that I conducted workshop, they are using the ZipGrade. So today I will be focusing on how to use the ZipGrade and club this using our Excel software, so that you can generate an item analysis report, and then you will take your decision accordingly. So let me proceed. Now, your ZipGrade report will be there once you make a report, and then you are going to analyze it. So let me reading the reports. Once you generate the report, then how you are going to deal with it. But let me end the slideshow here, and I will carry you to to what you can say, the ZipGrade, how you are going to use it. So this is my ZipGrade. Once you log into your ZipGrade, so you will find quizzes here. Here you can prepare your classes and you can make quizzes. So quizzes are here, and once you are going to click this quizzes, I have used 20 multiple choice questions. So let me share with you that I click this. Once you click this, you will get a try. This was my trial version. I did a trial. This is purely, these are purely arbitrary values, a trial version. And here you can see, you will find an item analysis report here. Here you can see the discriminatory factors. We will discuss later on what is discriminatory factors. And here is the correct option, and these are the answers for the question that you have used. I have used only 20 MCQs, which is evident here that we had 20 MCQs, and this was the minimum, maximum, average, and median score with the standard deviation like this one. From here we are going to generate item analysis report for our Excel version later on, but let me tell you that how you are going to download this report and how we have prepared an Excel sheet. Let me carry you to my Excel sheet. Yes, this is our Excel sheet, and I have another Excel sheet in which the formula is settled. So I think it is this one. This is. I will go to the another one, so that I will share with you all these things at the end. Yes, this is we have prepared an Excel sheet. It will generate, for example, the details. You will write the course ID here. We can share it to you if you request an email. Course ID, for example, any course ID. It is, for example, CVS Pharmacology, CVS, and there may be code name as well. For example, 319 or 312, whatever the case is. The exam is mid block or end block. You can. This is editable. We have protected this sheet. Number of question, for example, it is 20 here, and the number of students, whatever is it 10 or 20? It depends. You can edit it. Course organizer name is Dr. Niaz. If you are going to use the online machine reading, that will give you the Kranbacha values, but if you are using ZipGrade, they cannot give you, so you can put it 0. Or if you have online OMR machine reading, you can, for example, if it is 0.96, whatever the Kranbacha value is. And my aim today is not to discuss with you Kranbach values, so let me make it 0 or ignore it. And these are the areas where report will be automatically generated. The following items were too easy. Too easy mean that more than 90% of the student answer correctly. And the following items are too difficult. Too difficult mean that less than 20% of the student answer correctly. So this is too difficult. And poor discrimination. Discrimination means that it is not going to, a question is not going to discriminate between an able student, competent student, and a poor grade student. So this is the question number will appear here, and the following items has negative discrimination, mean that the poor student has performed well on this item number. So here at the scroll bar at the bottom, you see output. This is the output sheet. It will appear for you. So if you request, we can send you this. And this is the input. And this input, from where this input comes, and this input comes from what you can say. You will just use a cursor. This triangle appears at this. These are the rows, and this is the columns. You see here this triangle at the top left, and then you delete it. Once you delete it, and now go to the output, everything is 0 now. Everything is 0. Only you have to enter this data that you have with yourselves. And look here. Here is nothing is appearing here at this graphs. So let me go here and how you are going to give this create this report. So I will go now to ZipGrade. Let me go to ZipGrade. This is the report of 20 question, and you have to copy it from here. So you will put the cursor here, and once you put the cursor here, okay, let me cursor here, and you select it, drag it down, and you reach till the end. If your number of questions are 20 or 100%, no matter, you make a Control C, It is now, and go to the Excel sheet. Which sheet? Where is the input 1? This is the input. Remember, input 2 is that we will use another file. So input 1, you will put it here, and you put it this here, and then control V. It will give you a report that do you want to, because some cells are not of the same size. These cells are not of the same size, especially 1 and 2, because we copied it from ZipGrade, and ZipGrade, especially in this region. Let me carry you back to the ZipGrade. This one, you see that this first two row in the ZipGrade, this ZipGrade table, it is not complied with the Excel sheet here. So that is why in the Excel sheet they are going to ask you. So you see, your first question shall appear here at line number 3, but rest of the thing it will do it. Now I'm carrying you back to the output. Now you see this question number 1, 3, and you can see it. Question number 1, 3, 10, 11 are too easy. There is no difficult question, and with a poor discrimination it is 11 number question. With a negative discrimination, this is question number 20, and the question number 12, where the correct answer is something else, and this tells you that this question number 12, the students did not perform well. There were some distractors that attracted the students more. So I will carry you back to this question number 12. Look at this question number 12. Let me make it big for you. The correct option is D, but here it attracted the student to C. 12C, 70% the student has been attracted by this, the answer of this, the option C. So this output report will help you to analyze your item analysis report and to take necessary action at the end once your report is generated. Now look, your report is automatically generated, and if I carry you back to this second page of this report, you see now it is going to give you difficulty index of the question. So 2 difficult questions are not there, even difficult questions are not there in these 20. There were some excellent question, easy, and 2 easy are there. And if you go to the discriminatory index, mean that can discriminate between a good student and a bad student. So discriminatory index of the question, your negative discrimination, 1 question is there. And regarding negative discrimination, 1 question. So I will carry you to the calculations of Excel sheet, and here you can see the discriminatory index is here and at this column D. And you can go to this question number, this is question number 20, with a negative value of discrimination index, meaning that the poor student perform well than the good student, and it is reflected automatically here in the report. And this question, only 1 question is there, and this is reflected here that question with the question number 20 is being generated here. So what is the message for you? This will automatically report even graph for you. So if I am going to generate this report, what you will do, you will make a control P of this, and you will go to the convert this to PDF. And if I convert this to PDF, so let me make it what you can say trial. I'm not going to store it, trial version item analysis. So let me save it at the desktop. Let me save it at the desktop. So trial version, and if I save it at the desktop, a video will be a bit lengthy, but this is very productive video for you people, because now let me open this, going to the desktop, and open this some file, because we have to discuss this file as well. So let me carry you to all these things. So the trial version is here, and let me open this. Now look, this is your item analysis report, and this is it appeared with discriminating number, discriminating index, and difficulty, and you can make a print and report. This third page is appearing blank for you, and you can write manually, or you can write in this your report as well about these question number. So now I will close this file. I'm going to close this one, And let me carry you go back to the ZipGrade. Here in the ZipGrade, if I tell you that you have to give you have to use uh, uh, this CSV report, and this CSV report item analysis of the previous version. And if you are going to open this item analysis of the previous version, so I am going to open it. I opened this, okay, and I made Control A and Control C, and now I'm going to carry you to that file because there was an input 2 file as well. It is already there. I have copied it, so let me delete it. It's going to delete it. So in the output now you will not find the question with more than distractor. So if you put in this here that ZipGrade report, which ZipGrade report, so let me copy it again, because once you do not copy it, and so it will not be pasted. So let me go back to the ZipGrade, and going to this was the quiz report let me make a copy. Where you will copy, you will put cursor here at this top triangle, and then Control C. It is now activated. You will go to the that respective file. Here is input 2 file, and this input 2 file you will place it here. And once you place it here, so now look, going to the output file here. Now the question number 12C, the C, which meaning that the C at question number, if you go to the calculation at this input 12 question number 12, as I discussed with you, 70% student were attracted by option C, which is wrong, and the correct question answer is D. So it's up to you how you are going to use ZipGrade and using this Excel software. Now once you prepare this report, how you are going to deal with this now. So I will close this Excel sheet because so many sheets are there open. So let me go ahead and forgive me to close this one. This was for your exercise. Yes, this is what we have. Okay, this is now a report for a college that yes, we have used it, and in our college I'm not going to disclose his identity. And look at this, you see, this is item analysis report. You can fill all these criteria as we discussed. Course organizer, I will put it, the course name is XYZ. It may be in a block, it may be question maybe 120 or 100, whatever you do it. So whatever is the number of question, how is the number of students. Look, this question number 4, 46 and 92 is too easy. Too easy mean it is very easily answered, and nobody, more than 90% of the student has given correct answer. And these are too difficult question. Too difficult mean that these number of question are too difficult, that is not correctly answered by more than 20% of the student. So these questions need special attention, and you have to read either the stem or the stimulus or the distractor before releasing the results. And look at this. This is poor discriminatory. This question has poor discrimination, meaning these questions cannot differentiate between a good performer student and bad performer students. Again, it could be revised or reviewed, but cannot be discarded. And these are the special attention question with a negative discrimination. Negative discrimination mean that when you have a lot of students, and the negative, in case of negative discrimination, the poor student gave correct answer than the able student. It means there is serious flaw in your MCQ, and you should either revise your MCQ or reject this before scoring. But these are the number of questions, and these are the questions where, for example, question number 1, this after comma, this option D, this tell you that this option especially need attention because this is going to calculate automatically, and more students are attracted by a wrong option, and these are the option number E, pretend it is B. So while reviewing the question, this item analysis report can help you. And on the second page, you can find a complete consolidated report here in shape of graph as well. So the two difficult questions are 23 and difficult are 14. Remember, the Canadian, some international university use that this difficult, if I club these two, these shall be not more than 30%. Remember, but here you see this is 23 plus 14, so it will give you 7, and this is 37. So at least 7 questions are more in this question. This paper has more difficult question, and more difficult question mean that you have to review these difficult. Remember, when you are going to read the report universally, they just define difficult. This is a technical point to remember: difficult, easy, and moderate. I will tell you, this is universally, but I have segregated this difficult and too difficult. Too difficult is easy. Why? Because you will easily locate these questions. Too difficult here. When you are going to easily locate these two difficult questions, meaning these are the questions that need special attention. This needs special attention. Why? Because it is not properly answered by 20% of the students. So it means there may be some technical flaws in this question. So how you are going to read now this report? This is a very technical point. Let me first you will go to the difficulty factors. First you will go to the difficulty. Remember, this is a technical point to remember, the difficulty factor, and you will analyze this. Second, you will go to the discriminatory index, or discriminatory whatever. So but how practically you will proceed? See the common question. For example, here is question number 7. In negative, question 7 is also there, so we will focus on question 7. And here you can see that question 7, the option E, this has attracted the student more. So repeated question elsewhere will help you in pointing that which question is notorious. Similarly, if I go this question number, look 10, which is repeated here is 10 also, but 10 is not in negative discriminatory, so I will remove it, I will ignore it. And here you see 10 is then 24, 22 is not here in the too difficult, then 26 is there in the too difficult. And if I carry you to the negative discrimination or poor discrimination, so here is 26, and here you can go ahead as well, and that is the 26 days here. So we will focus on these questions 7, 26. You can take another question like that, like go to question number 19. The best way is that you shall check all these questions even before exam and after exam once you prepare the report, and then we will go ahead. So this is how you generated the report. Now what will happen, what you will do, how you will proceed with all these reports once you are able to generate this report. So let me carry you back to my PowerPoint presentation. Now let me start with this one, and reading the report. This is very important. Now report is generated using the ZipGrade data and Excel sheet, and how you are going to deal with this report. So we targeted question 7, 19 and 26. We will discuss that later on, but reading the report first, it needs to clear some certain terminologies, and that terminology we talked about the difficulty. So whether the question is easy, difficult or moderate. So remember, if you have 100 students, all give correct answer, so it means the question is too easy. It means the difficulty index is 100%. Or if you are going to express it as a factor, this will be 1 as a complete unity. So now if you go to the express this in what you can say in a formula. So difficulty index is being represented as the total correct responses by the student recorded and the total number of the students that appear in the exam. So therefore the values varies between 0 and 100, and I mean percent if you are going to. So the higher the number, the easier will be the question so far the difficulty index is concerned. And as a proportion, this will be 0.01 and 0 as a 1 as a unity because as a 100%. So now item difficulty level, if you different books has represented in medical education highly difficult, moderate difficult, or low or easy. So usually 80% of the question shall be easy, remember, and the medium shall be between these, what you can say, if 80% are easy, so this range and this range shall constitute the 20%. But if you go, I segregated the difficult and too difficult. I divided these into two. There was too difficult, I let me to write it for you, too difficult. So too difficult for the 20% I took, and if this is all 30%, so this will remain 10%. So it means this 30, this I have in my Excel sheet. Why? Because the lower this value mean, the more difficult is the question, and that is why I take it too difficult, and this needs special attention. This needs special attention as a before releasing the result, because sometimes there are serious flaws in this question as well. Now let me share with you an example, because most of you may not be knowing about item analysis, though it is not the mandate of today's presentation. So you have a multiple choice question where the option 1, A, B, C, and D is the correct. And remember, 44 students took in the exam, and this is the low scoring group, and this is the high scoring group. So if you divide this into four quartile mean upper quartile, this is upper quartile, this is lower quartile, mean 11. This is, if it is 44, so 44 divided by 4 mean 11 student come in each group. So 11 is in this lower group, 11 is in this mid, and this group, 11 is in this group, and 11 is in this group. These are the toppers, and these are the lower performers. So what is the message? That this lower quartile students are here, this is here, and the upper quartile students are here. So what is the message now? That multiple choice, an MCQ is having correct option D, and 8 in the upper quartile, 8 student give perform, and the lower group only 3 student perform. So I will write it here 3, and among these 11, 8 student did here. So let me do it. So calculating the discriminatory index mean that 8 minus 3 divided by 11, so it will be 0.45 will be the discriminating index here, you see. And what is the difficulty factor? Because 22 students here give correct answer. This is the total correct answer. So 22 students gave correct answer. So total correct divided by the number of the student that is appeared here is 44. So 50% of the student gave correct response on this MCQ, which has a correct multiple choice option D. This is how you are going to calculate difficulty factor and discriminatory index. Now you have taken all these things, so how you are going to deal with the report? Now you have a report that I discussed with you, how you are going to deal with these things. Now the message is that if the you will start with difficulty index. If the difficulty index is above 0.10, then the question is difficult. But higher the scoring mean the student tended to answer correctly, and the lower the scoring mean that most of the student did not answer correctly. If the discrimination index is between 0 and 0.9, then there is likely something wrong with the question and may need to be removed from the scoring. Remember, these things are very important. Discriminatory index between 0 and 0.9, and it should be sent back to the content expert to revise it before it is used again. So these are technical points to remember. We will go to question 7, but before going to question 7, let me share with you some report that how we are going to deal with this. So I will carry you again. This is some guidelines. These are some guidelines for reviewing. I will share with you. These are the guidelines for reviewing multiple choice question on UGME examination, and it was published in 2020. This is their reference, and these are the authors, and they have made work easy, so we appreciate their efforts. And thus you can download it, and for easy reference you can take. They have given some example also, but we have our own report. Now you have flagged question. Flagged mean that we decided our question are there. So how you are going to flag your question as sitting in the assessment unit? So the message for you is that once you flagged your question that this question is poor performer, mean either discriminatory index is very low, or what you can say the difficulty factor. So you will first start, as I said, with difficulty. If the question is difficult, let me take the pen here. Yes. So if a question is difficult, meaning as a rule of thumb, less than 0.3 value, mean 30% or less than 30% of the student as a whole answer correct, mean that this question is difficult. And as per our formula, we said 0.2, mean less than 20% is equal to 20%. It means 20%. So if the question is answered less than 20% by the student, which carries, so that question will be too difficult as per our criteria that we settled. Now, how you will go ahead? You have to check the answer key to ensure that the correct answer is there. Read the question to confirm that correct answer is listed. If so, check its accuracy and if any other answer would reply or not, because sometimes the other answer also replies. And this is usually a mistake is being done by our faculty. We will come to that later on while giving the example. Keep in mind this point and read the question to ensure that there is no clue. This is again important. This clue or some gesture being given as a typographic or grammar sometimes misguide the good student, and they have something in their mind. Sometimes they may have a very good correct answer, but that is being what you can say the student is being misguided. So you have to remove the ambiguity as well and confirm the question that the question is testing an objective. This is the most important thing, because certain time we have a question which is we take from the internet, which is on certain other objective. The level is not of the same of the first year MBBS or first year pharmacy or nursing. And what we are doing this serious blunder and mistake, because every program has its own learning objective and their learning objective level of as well. First year MBBS program will have totally different level of difficulty than the second, third year and fourth year and so on. And we are doing certain levels, certain mistakes. Now going back to the point. So once you check that there is nothing is there in the because in the international standard they take in 2 languages the exam, but this is not does not apply to you, because we take exam in English, especially here in Saudi Arabia and there in Pakistan as well. So they says if all these about these criteria are negative, mean then you shall focus on the discriminatory index, which I discussed with you previously. So they say if it is above 0.1, then the question is difficult, but at higher scoring tend to perform well, then you can keep the question. But if the discriminatory index is between 0 and 0.9, this is a technical point to remember, then it is likely something is wrong with the question and it may need to be removed from the scoring. Keep in mind this point. At certain point, the director of medical education or the DME or any other authority sometimes becomes they take their ego. Do not go and take it as your ego. If the question is having some negative discriminatory index, please remove that and calculate it from the percentage. There are certain other procedure for that as well. So you have to return this to the content expert so that this blunder shall not be repeated next time. If the question is extremely easy, more than 90%, 95% student has corrected, you can also revise it. And the same procedure so far discriminatory index. If the discriminatory index is negative, this is very important. Again, you have to check it. Is there any other typos or any clues, typographical mistakes are there, because it is going to misguide, as I discussed, the competent student. So confirm that the question is testing the objective as well. This is what I have discussed, dear colleague, with you in the workshop as well. So now what is important for you? You will have to take the decision now, because now you flag the question. The question maybe is poor. Why it is called poor? Because too difficult. Let me tag it. Too difficult plus negative discrimination, negative discriminatory index. Now this is a poor question, and for that this question shall be removed. But removal also needs a logic, and now there the decision can be either to delete a question. The decision can be you have to credit the question. The decision can be you have to change the answer key. And the decision could be that you will keep the question for the examination. And the fifth decision is that keep the question as such, and you do not need to take any decision. Now, when you are going to delete a question, you have to delete a question so when there is no correct answer is there. So I will carry you back to my presentation, and in this presentation let me share with you that this. Now look at this question 70. This was question 7. A 70-year-old male needs, remember, look at the age, needs to be treated with an alpha blocker. Now it is focusing on alpha blocker for overflow incontinence due to enlarged prostate. They has given a scenario, probably benign prostate hypertrophy. They are referring to which of the following drugs would you suggest in this patient that will not affect the blood pressure. Remember, this is alpha blocker, and you are talking about alpha blocker and alpha blockers. And you know all these things, that blood pressure is equal to peripheral resistance multiplied by heart rate into stroke volume, or this is called cardiac output multiplied by peripheral resistance. And this peripheral resistance is because of the alpha 1 receptor contribution of the blood vessel of the skin, cutaneous and deep visceral. So it is being contributed by the alpha 1 receptor adrenergic receptors. Now you are focusing on alpha blockers, and you are asking that which one is not going to affect the blood pressure. So which of the following drugs will you advise? Doxazosine, yes, it is one of the class. Phentolamine, phentolamine is a drug that is going to is it specific, or is it reversible or irreversible, or specific alpha 1 or alpha 2? And what is prazosin? You see, prazosin is specific alpha 1 blocker also. Tamsulosin is alpha 1 blocker also. The correct answer is tamsulosin and terazosin. Here your student perform, if I go to the report, they may go for this phentolamine or prazosin. The student may make a mistake. So you have to do not ask. The question is acceptable, but if you go to the tamsulosin mechanism of action, that is specific alpha 1 type A receptor blockers. So you shall use this here, that a 70-year-old male needs to be treated with a specific alpha 1 type A receptor blocking because of benign prostate hypertrophy, so that its blood pressure is not being significantly effective. Which of the following is specific alpha 1 A type A receptor blocking agent? Rather, you can remove this and you directly answer the question. Which of the following drugs is specific alpha 1 A type receptor blocking agent? Rest of the scenario is redundant, you see. So take care about while framing this question, and do not take the question. Take the question, prepare the question from your lecture. Now look, this is question number 19. And question number 19 was that neonates having a patent ductus arteriosus can be treated with which agent to induce relatively rapid closure and thus to avoid surgical intervention. So of course, this endomethacin, it relates to the NSAIDs, any NSAIDs, so non-steroidal anti-inflammatory drugs. Phenobar is out, epinephrine is out. To some cases, hydrochlorothiazide indirectly very far away, but they are not focusing, because here the logic is that certain prostaglandins are important to keep the patency of the ductus arteriosus, mean to keep it open. So friendly prostaglandin are inhibited by the NSAIDs. This is the logic. So you can revise this question how that, because this is going to keep the ductus arteriosus open. This option is yes, you equipped. But if you ask me, I will ask this as a class of drug. I will ask this question as a class of which of the following classes of drugs is being notorious for the early closure of ductus arteriosus. You can ask in another way, especially in the third trimester of pregnancy, and you can ask you can go ahead for the this version that endomethacin, yes, but rest of the thing become redundant. Why? Because a good student who knows that about this NSAIDs classification, he will pick this one. So it's up to you how diligently you are going to frame your question. This is question number 26. A blood test is performed on a patient with chronic renal failure, and it seems that level of phosphate and calcium are lower. Now look, level of phosphates and calcium are lower. This is the key information, and that is a chronic CKD patient. There also appears iron and aluminum deposition in the bones. Now this is some jargon that is misguiding the student in the bones. Which one of the following is most common complication of his conditions? The answer is osteoporosis. Osteomalacia is something else, diabetes. So a competent student will remove this one. Diabetes mellitus is out from this whole story. Then he will go because of the bone, so he will osteo, he will just think in these three. This one is also out. So your options, there are no plausible distractor. Now he is going to making a guess between these three, B, C, and D. Now the important thing is that correct option is, as per this question, is osteoporosis. So you are focusing now, assessing that in case of chronic kidney diseases, the phosphate and the calcium are lowered, and you are also now misguiding the student that iron and this aluminum deposition is there, because it may be attributed to aluminum toxicity that sometimes appear in the bone, and then the bone densitometry is very strong, you see, and the heavy density is heavy, and then the osteoporosis, the student may go and opt for this particular option. So this is not plausible, because already calcium level is less, the phosphate level is less. This is going to trigger what you can say, since already renal failure is there, and you know all these things, your examiner know all these things, and at the level of kidney, this hydroxy vitamin D is converted into 125 dihydroxy vitamin D, meaning that active form. So if kidney is there, so it is not converted. Once it is not converted, it is not converted into 125 dihydroxy. So consequently, the calcium level will be less. In order to complete this calcium, then the parathyroid hormone level will be increased. The parathyroid hormone level will be increased, and this parathyroid level is increased. This is called secondary hyperparathyroidism. So secondary hyperparathyroidism is is reflected, especially if I'm not wrong, because I don't remember now the scoring. So stage 4 and stage 5 of the kidney failure, secondary hyperparathyroidism. So why don't you ask the question directly that related to this? So now the objective, the course learning objective is very important, and the class objectives are very important. What you are going to assess, and this particularly aluminum deposition and iron deposition, you see, is going to misguide some students. So with me, if you ask, I will remove this portion and I will remove this option as well, and then we will keep the question on a certain parameters. What is the message for you before going to delete a question? As we discussed, if it is not an objective, not covered in the teaching, in mode of teaching, information transfer, and all answers, sometimes the all answers are incorrect, so you have to delete this question. And remember, as I said, when you are going to assess, assessment drives learning. Assess, you are going to assess, you are doing assessment through the MCQ. So please do not assess two parameters together. This is parameter 1, and this is parameter 2. Do not take two parameters in a stem together, in a single stem of the MCQ together. This is a technical point to remember. Like in this, this is you should remove this area, this and this, so because you are going to assess two things, and this is going to misguide the student. So if I carry you back to my when you are this is what we discussed, how when you are going to keep the question on credit, I share with you the Canadian University document. Let me share with you something, because we prepared something more for our college practice here, a Word document here, and you can see it. This is how you are going to assess this. Yes. So this is what we prepared at our college. We are going to implement it. The assessment unit is going to implement it, because a question is always having a general information in MCQ. In MCQ, usually it has general information part first in the stem, and then after stem there are options, and you know how you are going to deal it. So your assessment unit shall have this pro forma like this. I can send you, or you can just make a copy of this. First, you have to check whether your question is on the objective or otherwise. It should be on the course learning objective. Yes, these are the things that you have to fulfill in a multiple choice question. Congruence with the course learning objective. The content shall be relevant. If, for example, like in a question number 26, some contents were not relevant, though indirectly it was relevant. Remember, we are not going to test our ability on the student. We are going to test that the student has learned something that we have shared with them in the classroom. Assessment is for learning. Assessment is not to pass and fail the student. So overall, clarity is there in the question. Correct format and style should be there. There should be a simple language. Do not show your English competency here. Focus on a single aspect, as we said. Do not go to two aspects, because then two aspects will create problem for you. Try to avoid in general information grammatical error. Take the options. Vague terms shall be removed, and absolute terms shall also be removed. And then in the stem, you see what you should do. There will be a central idea provided in the stem. Necessary information shall be there. Do not give redundant and unnecessary information. And the information shall be properly sequenced so that it can lead the student to select a proper answer. So there shall be no window dressing in the stem. Excessive verbiage and excessive terminology shall not be there. Do not use not, except, negative shall not be there. Also, sometimes in writing the MCQ, do not use the fill in the blanks. And remember, one thing which is very important amongst the option shall be effective. It shall be a plausible distractor. It shall be homogeneous. Homogeneous mean that you are going to assess your student. For example, I told you, I will carry you back. Here is the answer. This diabetes mellitus is not associated, and this curve. So the student will remove it, and these three are homogeneous. So going back to the other slide and let coming back. So option shall be homogeneous, it shall be independent, and length shall be proper and equal, because sometimes the one option length is not equal, so the student will focus on that. He is going to make gesture. Illogical grammar and grammatical mistake, all these shall not be there, because they are going to misguide the student sometime. And then remember, whether your MCQ at the level of Bloom's taxonomy was at the level of recall, understanding, or application. Remember, we are trying to use scenarios, but our scenarios has so many redundant information, and we try to make it application, and then then the difficulty level of the student, the paper report goes so high, then we are not able to deal with all these things, because we are not doing the item analysis. So my dear colleagues, at the end, let me tell you what you are going to assess. Are you going to assess your ability, to show your ability to the student that your teacher is how much competent and has framed such a beautiful question? Are we taking the question from the fellowship exam or the books? Please do not do it. Assess what you teach, and if you do this, you will be you will frame a very good question. When you are going to change the answer key, if the key is wrong, change it, remark it before declaring the results, and send the item to the expert again, so that keep the question on the exam if no issue is there. And thank you very much. If you have any question, you can ask me. The audio tape is too lengthy, but this is how you are going to use the ZipGrade and Excel software and to prepare your item analysis report. Thank you very much.